Good evening. I'm Dr. Robert Peppercorn, and this is the Medical Explorer. As a specialist in skin cancer, cosmetic laser surgery, liposculpture, and allergies, and as host of this program, I will take you on an exploration of the medical communities of our Northern California counties and bring you behind the scenes of medical care practices right here in our local areas. Tonight, the Medical Explorer will explore a part of the human body that affects us all. Tonight, we will return to the subject of dentistry. On previous programs, we visited the offices of oral surgeons, a pediatric dentist, an orthodontist, and other general dentists. Tonight, we'll explore another area of dentistry that focuses on cosmetics and beauty. This evening, we will explore cosmetic dentistry. Our special guest tonight is one of our area's most respected dentists, Dr. Richard Cordano. In tonight's program, Dr. Cordano will take us behind the scenes of his Yuba City office as he shows us an actual technique that allows him to transform a person's smile through the miracles of modern cosmetic dental techniques. Think about it. You can have teeth just like a TV star or media personality. The view will be fascinating as we watch an actual procedure, so stay tuned. In the pharmacy corner this evening, our award-winning neighborhood pharmacist Bob Church will tell us about the problem of attention deficit disorder, currently referred to as ADHD. It seems that this diagnosis is being increasingly used to describe behavior problems that affect many children and has also been called hyperactivity syndrome. Are there new treatments for this difficult and frustrating disorder that affects so many children in our society? Well, we'll learn the answer to this question and others about attention deficit and hyperactivity disorder in tonight's Pharmacy Corner. Tonight's program will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Before getting to our topics tonight, let's take a look at the latest medical news. Reducing children's television time and video game playing might make them less aggressive with classmates, says a study in the Archives of Pediatrics and Adolescent Medicine. At one California school studied, 100 third and fourth graders received classroom lessons aimed at curbing their use of TV, videotapes, and video games. At a similar school, 100 youngsters didn't receive the curriculum and served as a control group. 8 months after the instruction started, the kids who listened to it said they'd cut TV use by a third, and their parents agreed, says researchers at Stanford University Medical School. Youngsters in the control group reported no reduction in their media use. Classmates reported a significant drop in physical aggression by those who limited their TV and video game use, but no drop for the control group who kept using the media and TV watching. A single gene in skin cancer tumors seems to predict whose cancer will spread and whose will not, researchers say. They hope to develop a test that will tell a doctor which patients need extra screening after having a melanoma removed. Patients whose tumors express the melastin gene, meaning the gene is active in the tumor cells, are most likely to survive a melanoma, the joint team of researchers said at the Massachusetts Institute in Boston recently. The activity of the melastatin gene in cutaneous melanoma tumors accurately predicts which patients are at most risk of having their skin cancer metastasize or spread, and those most likely to remain disease-free based on findings in the study. The findings were published in an issue of the Journal of Clinical Oncology. The U.S. government has added a new vaccine against diseases that cause meningitis and bloodstream infections to the list of shots that infants should receive before age 2. A new childhood immunization schedule issued by the Centers for Disease Control and Prevention recommended 4 doses of the new pneumococcal conjugate vaccine for infants aged 23 months and younger to combat the disease. This vaccine would be given at the same visits when children receive other vaccines on their normal immunization schedule. The vaccine is also recommended for children up to age 5 who have diseases such as sickle cell anemia, chronic illnesses, or weak immune systems, or who are infected with the virus that causes AIDS. It's now time for us to visit our pharmacy corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's most respected neighborhood pharmacists. Returning tonight in our Pharmacy Corner is our award-winning registered pharmacist, Bob Church, from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you.
How big of a problem is ADHD?
Well, ADHD is becoming more and more of a problem simply because it's getting more and more attention from a lot of different areas. It's a very common psychiatric disorder in children that is characterized by hyperactivity, inattentiveness, and impulsive behavior. It's also characterized by the fact that a lot of the children do poorly in school. They don't complete tasks well. They avoid situations that require prolonged attention or concentration because actually many times those types of situations make ADHD even worse.
Does anybody know what causes the condition?
It looks like it's sort of a multifactorial cause, meaning that there isn't one clear delineated cause. There is some evidence that there's a genetic factor there, but that hasn't played out. They haven't, in other words, they haven't found a particular gene that's responsible for this. There is evidence that there is some functional or structural differences in the brains of people who have ADHD.
Injuries maybe, childhood injuries?
Could be. They're also talking about maybe there are some environmental factors such as maybe lead or diet or things that happen during pregnancy. There really isn't.
No precise answer.
No, there isn't.
What medications are used to treat it?
They've actually tried a lot of different medications from antidepressants, the old tricyclic type, to the new more widely used antidepressants that control serotonin and other neurotransmitter levels. They've tried amphetamines like dextroamphetamine. They've mixed amphetamine salts, a drug called methylphenidate, which is Ritalin. Most people know as Ritalin. Right. But out of all of those, the ones that they call psychostimulants, the amphetamines and the methylphenidate, are the first-line drugs, and methylphenidate has had the most study over a longer period of time, and it's more widely used. So that's really the one that we see a lot of use on, and then we see the dexedrines, the Adderalls, which are the amphetamine drugs.
Interesting. So Ritalin is the generic name is methylphenidate.
Yes.
What's dosing like? What response?
Okay. Well, what they normally do, the normal dose range would be somewhere between 5 and 60 milligrams a day, and it can be dosed in immediate release tablet form or sustained release tablet form. Up until just recently, we only had one sustained release tablet form, and that was Ritalin's. Now there's a new product which is called Concerta, which is a new type of delivery system for sustained release methylphenidate. And from everything that I have seen and read so far, this may be the answer to getting a smooth delivery of medicine from the time the child goes to school until they get home in the afternoon, which is really what you're trying to do so that they can function well at school. If you take immediate release tablets, you have to be dosed at school.
I see.
There's some drawbacks to that, not only in the way the drug is delivered, but the child having to go to the nurse's office to get it. With Concerta, there's a very nice bell curve. It's a rapid release of medication initially, and then a time released over a period of 8 hours. Now, we don't have enough experience with it yet to know whether that's really going to play out the way they say it will, but if it does, I think it's going to be a much better way to give methylphenidate than we've had before.
Now, it's always fascinated me, even since school, that you give a stimulant to people that already seem stimulated, and they already seem hyper. That's why they call it hyperactivity.
That's right. And it has to do with dopamine levels, which we don't really understand why this is working, other than you're not reuptaking that drug back into the neuron. You're getting more of it at the cellular level. If you and I took those drugs, we would become extremely hyper or agitated depending upon how much we took, but it wouldn't have the same effect that it does on hyperactive or attention deficit patients.
Interesting. Are there side effects, though, with it?
Actually, there are a few, but in actual practice quite minimal. The ones you might expect would be insomnia, a little bit of nervousness. Usually in practice, those things are dose-related, and they seem to dissipate or disappear after you've been on the drug for a while. There may be a little bit of weight loss involved there, too.
Is there controversy about using these drugs in kids?
It's a very controversial drug, and for a lot of reasons. Number one, it's a condition where you don't know what's causing it. You have no really solid, definitive way of assessing it and diagnosing it. And you're using a drug that may have to be used for an indefinite period of time. You're using a drug that the parents consider as altering their child's behavior. You've got a lot of media attention now. You've got a lot of attention in the schools. You've got a lot of diagnosing on this now. So, yes, it's very controversial, and there's also a drug abuse side of this. There's potential drug abuse. In fact, there was just recently a program on television about the abuse of this drug by kids who are getting the drug from children who have a legitimate use, and they're using it for recreational use, which I wasn't even aware of. So, yes, it's a very controversial drug, and I think for a number of reasons.
Well, as we've seen on another Medical Explorer show, Dr. Shiro, the psychiatrist in town, is using the new SPECT scan to monitor kids with this, and maybe that'll help see how effective the drug is as he monitors the scans.
I think it will. I think that's an incredible thing that they're able to do now.
Now, what about growth? Does it affect growth in kids? Is that a controversy too?
Yes, and it looks like there may be some growth retardation, but the end result, when people have finally gone off the drug, it doesn't seem like the actual end height has been affected. It's like maybe it retards growth for a while, but also that may have something to do with the condition itself and not be drug-related. That's still up in the air. So I'm not sure how significant that is at this point. There's a theory that when children are on vacation during the summer months or a long holiday vacation, to give them a drug holiday, in other words, don't give them the drug, that may be effective, but that hasn't been proven either.
Right. Well, Bob, as usual, that was very useful and very important information, and I hope our viewers will discuss their questions about the treatment of attention deficit hyperactivity disorder with their pharmacists and physicians very soon. We look forward to you returning to the Pharmacy Corner on future programs. Thank you very much.
You bet. Thank you.
You're welcome. Now on with the Medical Explorer. Cosmetic improvement and rejuvenation is a very popular subject in the United States and across the world. We're all familiar with cosmetic surgeries that can improve the face and body. One of the newest trends to enter the scene of cosmetic improvement is the specialty of cosmetic dentistry. With the use of new technology and skills, dentists can make improvements to the appearance of the teeth and mouth that can have a major beneficial improvement on facial appearance. Let's leave our Medical Explorer studio here at the Advanced Dermatology and Laser Center and travel to Live Oak Boulevard, office of Yuba City dentist Dr. Richard Cordano.
Okay, what we're going to be doing today is restoring Mary's upper teeth, all of them except for 2 of them. So we're going to be working, doing the complete upper arch. We're going to be replacing all of her restorations with metal-free restorations except in one area. So that's basically what we're going to do today.